Have you ever wondered how you were going to pay for your doctor's appointment or if you could afford to go to the dentist? Sadly, this is something over 50% of Oklahomans experience every time. Today, I'll discuss why Oklahoma should implement a policy to Oklahoma should implement a policy to provide affordable healthcare access for those who lack insurance, are in low income families, and who lack jobs. But before we go further, I just want to say this topic is something that affects many of us, and I hope for significant change. The biggest problem is that Oklahomans have low access to healthcare due to the high costs. The increases in insurance premiums cause these high costs, along with many being underinsured and those who are insured paying more to compensate for the losses. Emma Murphy uses a quote from Glenn Mulready this year saying, "Leaders and citizens need to be prepared for the consequences of these subsides ending with significant changes in healthcare and insurance costs anticipated," expressing the worry about these crazy costs. Mulready also exclaims over 300 Oklahoma residents have experienced increases in costs up to 75%. As a result, more Oklahomans have either um, um, most Oklahoma residents are uninsured or underinsured, making it difficult or impossible for them to afford necessary medical care. However, those who do have access to health care in Oklahoma often aren't getting high quality care. It's been known that Oklahoma residents have difficulty acquiring um, good health care. This is caused by many rural areas not being properly staffed with the correct and/or needed amount of healthcare workers, along with the financial difficulty of paying them. This and other reasons like increasing pricings of medication and medical resources affect the quality care many receive. Dr. Sarah R. Collins, the senior scholar and vice president of the Healthcare Coverage Access and Training Health Systems um, Performance at the Commonwealth Fund, said Oklahoma consistently ranks low in the national comparison of healthcare access, specifically 49 out of 50. It has been inferred that our state's overall literacy on healthcare is lower than usual, leading to the overall poor quality of care. These are all indicators of systematic issues that reduce the availability to our quality of care. With these last two reasons in mind, Oklahoma should implement a policy to provide access to affordable health care for many individuals who currently lack insurance, are unemployed, or belong to low-income families. While there have been previous efforts in the past to resolve this issue, such as the Affordable Care Act or the ACA, the reality is that this problem has still truly been unmet. Cities like Oklahoma City and Tulsa have taken steps towards expanding the coverage, but the challenge still persists. According to the American College of Physicians, the National Organization of Internal Medicine Physicians, stated the ACA will make health insurance. Let me find it, sorry. Health insurance affordable by providing health insurance tax credits and cost sharing to the uninsured, underinsured, and small businesses. These were bold and hopeful promises, and while the ACA did help millions across the country, they have fallen short for Um, many Oklahomans. Um, Insurance premiums remain high, coverage is often limited, and navigations of the system can be overwhelming, especially for those with limited income or unstable employment. This is why a new state driven policy is urgently needed. By expanding access to affordable health care through targeted reforms, Medicaid expansions, and enhanced subsides, or, or the development of county health networks, we can immediately change lives of hundreds of thousands of Oklahoma residents. For many, access to affordable healthcare can mean earlier diagnosis, better management of chronic illnesses and treatments, and fewer emergency visits. This gives a peace of mind knowing that there is help available when needed. Healthcare is not just a service, it's a lifetime, and now it is time for Oklahoma to ensure that no one is left behind when needed. In conclusion, Oklahoma should implement a policy to provide access to affordable healthcare by affordable healthcare. So many people can stop overpaying for insurance premiums, and we can prevent the situation where people are forced to rely on inadequate care. Um, or worse, go without care altogether. Everyone, regardless of the income, employment status, deserves the chance to see a doctor, um, fulfill a subscription, and live without the constant fear of a medical emergency becoming a financial disaster. Thank you.